I want to tell you a story about one of my patients
that I recently saw in my clinic.
We'll call her Mary.
Her name is Rosa.
I'll call her Jessica.
She came to me at about 22 weeks.
Due to a pregnancy that had complications incompatible with life.
She found out that her pregnancy was suffering from anencephaly.
Her husband had just lost his job, and they had 3 kids to provide for.
They decided it was not a good time for them to become parents.
She had been the victim of rape.
She told me she couldn't possibly continue the pregnancy.
She wasn't able to have the continuity that she had highly desired.
I think about all the different Marys that are out there in different states and how these abortion bans could unequally affect them.
The House is moving forward with a plan to ban abortions after 20 weeks.
A controversial abortion bill called the Heartbeat Bill is now sitting on Ohio Governor John Kasich's desk.
How is it reproductive health care to have an abortion? You're not reproducing.
These days often look very dark.
It seems like every single day in the news cycle, there's something involving reproductive health.
We are protecting the sanctity of
every day, every patient that I see an example of either social inequity or racism or bias.
The current political climate around comprehensive reproductive health care is that we're at war.
It can be pretty disheartening at times.
I wanted to be an abortion provider because I wanted to meet people right where they were.
Providing abortion is part of women's health care, and I don't want to just do part of the care trajectory for a patient. I want to take her through every step of the way.
It just seemed very clear to me that women's ability to participate fully in the world required them to be able to control their fertility.
In today's political climate, we need to be out there fighting for our patients and fighting for what's best for them.
Hi, Marie Matthews, nice to meet you.
Nice to meet you. I had a patient that had a heart condition and that would be detrimental to her, so she wanted to terminate the pregnancy.
I view myself as an advocate for abortion, not only in the United States. I want to be a global advocate.
I want to have the chance to really make sure people understand, really this is what you're doing with this law that you're passing.
I recently had an opportunity to participate in the Laura Ingraham radio show. After saying yes to doing the interview, it was an intense 12 hours of prep.
Joining us now, Dr. Tracy Wilkinson is a pediatrician, fellow with Physicians for
I felt like I had an entire army standing next to me of the physician staff that had gotten me ready for that call.
I liked how you framed it.
I just said in my head, here we are, let's go. I can honestly say by the end of the interview that I thought my prepping questions were way harder than Laura Ingraham was on me.
Our patients come first and their safety comes first, and empowering them to make the decisions that are best for them comes first.
Doctors know best, and doctors know best because they listen to their patients. That's our responsibility.
As a physician, you're not only being a physician to your patients, you're being the major supporter.
Sometimes I think it'd be easier not to do this line of work, but at the end of the day, I just can't sit back. If I'm not gonna fight for my patients' rights, no one else is.
As a pediatrician, I believe that it's really important to make sure our patients, including my patients, have access to all the information and services they need to have safe sex when they grow up.
When the patient gives me a hug, it doesn't matter what else was going on. It's like, I did a good thing today, and I'm looking forward to doing the same good thing tomorrow.
I was able to counsel her about her options in a truthful and non-judgmental manner.
I live in a state where thankfully I was able to help her.
As long as my patients have all of the information that they need about their own medical care, I trust them to make their own decisions.
And be with patients in some of their toughest and most vulnerable moments.
You know, Laura, the reason why I'm here and why I work with Physicians for Reproductive Health is to add to the voices that comprehensive reproductive health is important and vital for everyone. And we all benefit when there's comprehensive access.